Hello, welcome to the Advanced COVID-19 Clinical Management Certification course for Bangladesh. My name is Dr. Ruhul Abid. I'm a physician scientist and an associate professor at Brown University Alpert Medical School, as well as a faculty at the Center for Human Rights and Humanitarian Studies at Brown University. I'm also the founding president of Health and Education for All, known as HAEFA. Today, we welcome you to the Advanced COVID-19 Clinical Management course, which is a collaboration between the Directorate General of Health Services, DGHS Bangladesh, Brown University, Project Hope, and HAEFA. The Center for Disease Control, DGHS, and the HAEFA Bangladesh were supported by the USAID and Save the Children to organize and launch this course for the physicians of Bangladesh. Here is a course overview. This Advanced Clinical Management Certification course will cover the current knowledge and skills needed to confidently treat COVID-19 patients. This course was developed at Brown University using current best evidence and in conformity with the 9th version of Bangladesh National Guideline for COVID-19, which was published recently. This course was developed primarily for physicians of Bangladesh at all levels, at the Upazila health complexes, district hospitals, tertiary and medical college hospitals, private and corporate hospitals, and also for the physicians working at outpatient or outdoor departments, as well as for the physicians who are providing telemedicine for COVID-19 cases at home. Here is a brief COVID-19 situation analysis in Bangladesh as of May 17th, 2021. As we all know that the first COVID-19 case was reported in Bangladesh on 8th March 2020. Since then, Bangladesh has recorded more than 780,000 COVID-19 positive cases and over 12,000 deaths. For COVID-19 tests, Bangladesh has performed 45 tests per 100,000 population, 3.9 positive cases per 100,000 people, and a recovery rate of 92.5%. And a case fatality rate is 1.56%. Here is a brief picture of vaccination. So far in Bangladesh, more than 7 million people registered for vaccinations. Out of that, 5.8 million people received their first dose of vaccine. 3.7 million received the second dose, which brings us to a national coverage for the first dose at 11.7%, and the Dhaka city coverage for first dose at 38%. Here is a brief history of COVID-19 pandemic in Bangladesh. As we mentioned earlier, that March 8th was the first COVID-19 positive case detected in Bangladesh, and WHO, World Health Organization, announced or categorized COVID-19 as a pandemic on 12th March 2020. Bangladesh saw its first COVID-19 related death on March 18th, 2020. And Bangladesh government announced or closed all the educational institutions on March 18th, which was followed by a national lockdown or general holiday for Bangladesh from March 26, 2020. And then in April, May, June, July, August, September, and October, Bangladesh saw increased surge of COVID-19 cases and COVID-19 related deaths, which was gradually going down by the end of 2020 and the early part of the current year, 2021, which again was reversed in March, April, May of this year. And to tackle this current surge, Bangladesh government announced another lockdown, nationwide lockdown on April 5th, which was extended until May 23rd, 2021, as we record this course. The main objective of this course is to understand the current best evidence to make decisions about the care of individual patients with suspected or confirmed COVID-19, and to help the clinicians to understand and interpret the common diagnostic tests and to carry out the best treatment strategies to safely and confidently manage patients with COVID-19 in the hospital setting and at home. In brief, the main goal of this course is to help the clinicians have a standardized treatment protocol or treatment management guideline for mild, moderate, and severe COVID-19 cases in line with the most recent COVID-19 national guideline of Bangladesh. This is the outline of the course. This course has 3 modules, and each module ends with a self-learning case scenario for practice for the participants. And module 1, which is case management of COVID-19 at home and in hospital settings, covers the clinical presentation of COVID-19, infection prevention control, diagnosis, clinical management, patient monitoring, and admission, referral, and discharge criteria from the hospital, telemedicine, home management, nutrition, and mental health of the patient and the caregiver. And the case scenario, which follows this module 1 for the practice of the participants, is titled Management of COVID-19 in Low Resource Settings, such as an Upazila Health Complex or district hospital. Module 2 covers critical illness of COVID-19. It covers recognition of the patient with critical illness, including respiratory failure and acute respiratory distress syndrome or ARDS, septic shock, basics of stabilization and resuscitation, management of critical COVID-19 illness, and mechanical ventilation, fluid management, and hemodynamic support. This is a case scenario for practice, which is a self-learning module, management of critical illness. And module 3 is it covers COVID-19 associated complications, such as cardiovascular, neurologic, and renal complications, as well as obstetric consideration, pediatric considerations, post-discharge care, including long-term effects of COVID-19, and finally, COVID-19 vaccines. This has a case scenario for self-learning, which is titled as Management of Complication of COVID-19. Here are some housekeeping rules or the course instructions, which you need to know and study very well before you take the course. So the first one is you need to finish all the modules and learning case scenarios, which are practicing case scenarios, to be able to sit for the certificate completion test. However, it is not mandatory to take all 3 modules at one time. You can log in at your convenience anytime and take and complete the modules at your own pace and convenience. Every time you log in with your ID and password, your progress will be recorded automatically. However, we recommend that you take the modules sequentially, module 1, module 2, and then module 3, followed by the self-learning case scenarios of each module. After you complete all 3 modules, you will be eligible to take the certificate completion test. If you score a pass mark, which is usually 80%, you will be able to receive an online printable certificate issued by the Directorate General of Health Services, DGHS Bangladesh, Brown University, Project Hope, and HAEFA. In case you do not pass the test at your first attempt, you are eligible, or you can take the test multiple times, as many times as you need. And you can also review any modules at your own pace as many times as you wish. With that, I'll conclude my introductory talk, and we welcome you to the first module of our Advanced Clinical Management Certification course, and wish you all the best and stay safe.